Good morning everyone. My name is Dr. Pankaj Londe. I am a lecturer in the Department of Periodontology. So today the topic that we would be talking upon is periodontal prognosis. So to begin with, let's see what exactly prognosis is. So prognosis is a prediction of the probable course, duration and the outcome of a disease which is based on the general knowledge of the pathogenesis of that particular disease and the presence of risk factors for the disease. So there are three types of prognosis which is estimated during the clinical course of diagnosing a particular patient. So the first one is diagnostic prognosis. So it is basically an evaluation of the course of the disease without treatment. Second is the periodontal prognosis or the therapeutic prognosis, which given the state of the art and science of the periodontics and the knowledge and the skill of the practitioner, which will affect the periodontal treatment and the effect of that periodontal treatment on the duration of the course of the disease. That is therapeutic prognosis. And third is prosthetic prognosis. So based upon the clinical diagnosis and the treatment which is given for that particular patient, how would the prosthetic rehabilitation will suit the patient, will give us an idea regarding the prosthetic prognosis. So there are three important concepts which are seen in prognosis. So number one is the definition of the intended outcome. Second is the timing of the projection. And third is consideration of individual teeth versus the overall dentition. So there have been many classifications given by different authors, but to be concise, and the one which we routinely follow and which has more clinical applications is the classification which was given by Maguire and Nunn. So Maguire and Nunn followed up 100 patients for around 5 to 8 years. So they had given a more detailed stratification of the prognosis depending upon good, fair, poor, questionable and hopeless. So according to them, good prognosis was approximately 85% predictable, fair prognosis was approximately 55% predictable, and poor and questionable were highly variable. So what all things do comprise in that particular set of the set of prognosis which they had given. So excellent prognosis, according to them, excellent prognosis is where there is no bone loss, the gingival condition is in excellent health, the patient is good and cooperative, and there is no systemic or environmental factors. Then second is good prognosis. So it includes one or more of the following, which includes adequate remaining bone support, adequate possibilities to control the etiological factors, and to establish a maintainable dentition. Then coming in fair prognosis is one or more of the following, that is less than adequate remaining bone support, some degree of tooth mobility, there is furcation involvement, which is usually grade 1, followed by acceptable patient cooperation and presence of limited systemic or environmental factors. Then in poor prognosis, there is moderate to advanced bone loss, there is tooth mobility, there is grade 1 and grade 2 furcation involvements, it is difficult to maintain areas, and the presence of systemic and environmental factors which is present. Then questionable prognosis, over there we have advanced bone loss, grade 2 and grade 3 furcation involvements, tooth mobilities ranging from grade 2 to grade 3, inaccessible areas, presence of systemic or environmental factors. And the last one is hopeless prognosis, which includes one or more of the following, that is advanced bone loss, non-maintainable areas, extractions which are indicated for few teeth, presence of uncontrolled systemic or environmental factors. So in any particular case, the duration or the position when we establish the prognosis is usually in this particular manner. Usually we do the diagnosis on clinical examination, which will give us a provisional prognosis, after which the phase 1 therapy would be carried out. Then there would be reevaluation of the treatment which has been done in the phase 1 therapy, and that would give us the final prognosis, and based on which would be the definitive treatment plan would be planned. Then prognosis can be divided into two types. Number one is overall prognosis and number two is individual prognosis. So number one, overall prognosis. So overall prognosis, it is basically concerned with the dentition as a whole, with again and the factors which may influence the overall prognosis. It includes patient age, then the severity of the disease, systemic factors, habits such as smoking, then the presence of plaque and calculus and other local factors, patient compliance and the prosthetic possibilities. So based on this, depending upon the age of the patient and which particular strata of the age the patient is in, will give us an idea regarding how the prognosis of that particular dentition would be. Then depending upon the sex as to whether male or female, so there are few diseases which are more prevalent. There is some gender predilection for that, so gender plays an important role in prognosis. Then the second would be systemic factor, which is the most important consideration in overall prognosis. So diseases such as diabetes, uncontrolled diabetes might have, it might affect the outcome of the treatment plan or the progression of the disease. And then systemic factors, and then habitual factors such as smoking, which again has detrimental effects on the periodontium. So again, that will affect the prognosis or the overall prognosis of the patient. Then coming to the individual prognosis is more concerned with the singularity of the teeth which are present. So it is localized to the localized factors such as the presence of root concavities, presence of cemental enamel projections, presence of the type of bone loss which is present, the type of pockets which are present, whether they are intrabony or suprabony, then the type of developmental grooves, then proximity of the root, tooth mobilities. So, and again the prosthetic factors would be abutment selection, caries, non-vital teeth, and resorption of the root. So today we'll speak about the overall factors or the factors which influence the overall prognosis of the patient. So patient age, again the onset of the disease will depend upon the age of the patient. If the patient is in the age bracket of, say, in the 5th or 6th decade of life, the prognosis is usually not that great compared to the patients whom the age bracket is lower. Then the severity of the disease, it again depends upon parameters such as pocket depth, level of attachment, degree of bone loss, and the type of the bony defect present. Plaque control. So it depends upon the overall oral hygiene which is maintained by the patient. If there is effective plaque control which is carried out by the patient, the chances of progression of the disease is less or it is altered, because of which the prognosis is hampered. Then again, patient compliance and cooperation. If the patient is compliant and cooperative with all the preventive measures which we have suggested to the patient, then the type of prognosis that we expect from that particular patient would be good. Systemic factors includes diabetes and other diseases such as hypertension, immunodeficiency states, genetic factors, and stress.